We're into the third wave. We've got some tough weeks ahead of us, but it should not be said that Manitobans haven't done their best. Most have, and I say thank you to them. You made a lot of sacrifices. You've given your best efforts to get us in the right position to recover. You've bent the curve successfully. We need to do that again now. Our government has been focused on being ahead of the curve too. We've learned as we've gone, and we've done our very best to strengthen the mechanisms that are at our disposal with some of the toughest enforcement in the country. I'll talk more about that in a minute. With very strong restrictions compared to most other jurisdictions across the country, many of which we maintained throughout this pandemic. Travel restrictions, for example, and others. We continue to look to do our best to keep ourselves safe and to keep our health system safe. But the reality of COVID and that third wave is imposed on us now, belatedly. We were, compared to most other jurisdictions, doing very well, but we are now, though we've delayed the advent of this third wave, it's here. Today I want to talk about three things, three steps that we're taking, I guess in a general sense to reward good behavior and encourage it, and to address some of the less than respectful behavior that we've seen. I want to start with enforcement. As a government, we're continuing to target our enforcement efforts where needed. We've developed and implemented some of the toughest measures, but those measures have to be enforced. They don't work unless people abide by them, as we're seeing in some cases. We're the only jurisdiction in the country that publicly reports on our enforcement efforts every week, and our multifaceted enforcement strategies have focused initially on public education, and we continue to make every effort to communicate and educate. It's getting to the point, I think, where most Manitobans, and I'm one of them, are frustrated that people don't seem to, some people just still don't seem to get it despite all those efforts. We moved beyond education and warnings to, of course, ticketing. As part of these extensive efforts, we've implemented Operation Safe Apart in partnership with the City of Winnipeg. We've designated additional enforcement officers, I'm told more than any other jurisdiction, from the private sector, from various government departments, of course from our law enforcement agencies. Over 3,300 Manitobans are involved in that. And I would say at this point, I would really encourage Manitobans to support those people when they're doing their job. It's not an easy job, but it's an important job. And I've had too many reports of disrespect being shown to people who are doing their best to help keep us safe, physical and verbal. I would ask Manitobans to respect the fact that these folks are doing a job which is not easy to keep you safe, and so they need our encouragement and support. We have designated additional enforcement officers as well throughout the pandemic. We built a training program for our enforcement officers. We've established preset fines. We've created a statistical analysis and public reporting system and a public complaints system, and I thank the members of the public who have availed themselves of those services for being part of helping to create a safer Manitoba. We've implemented as well a provincial command and control structure. We've established dispatch systems. We've created the Commissioner's Coordination Center to coordinate the activities of this agency, and these agencies, I should say. Since enforcement efforts began in April of last year, there have been over 4,000 warnings. There have been almost 1,300 tickets so far. There'll be more coming and reported upon, of course, in coming days. We're talking about close to $2 million in fines that in each category leads the country. Just this past week alone, COVID enforcement officers inspected over 4,000 different locations around the province to ensure compliance with COVID prevention orders. Our province has responded. We've attended, in conjunction with law enforcement, approximately 50 different protests in Winnipeg and other communities around the province. Each protest response requires significant planning. It requires collaboration among law enforcement officials to ensure that the public and all officers and personnel are kept safe. while they're doing their job. And video evidence is used to identify those in attendance. Fines are issued following an investigation. And as a result, a significant number of fines have been issued and will continue to be issued while investigations are still ongoing on some of the more recent protests. So in conclusion, I want to be clear with Manitobans and with those who are considering disrespecting their neighbors and friends by breaking public health orders that we are outpacing most other provinces in enforcement efforts, and we're going to continue to. Our per capita enforcement is roughly 100 tickets per 100,000 population, and that is the highest in the country. But we must do more to enforce our public health orders. Our enforcement efforts are always continually realigned with the new public health orders whenever they're introduced. And where problem areas are identified, they're also responding to that. And so, first announcement today. We are announcing the doubling of fines for individual repeat offenders. I am announcing also the doubling of default payment fees for failing to pay your fine on time. The vast majority of Manitobans are following these fundamentals. They're following the rules. That's important, and I say again, thank you for doing that, and please keep doing that. But there is a small, selfish minority of people that aren't doing their part. And in doing so, they're putting the health of themselves and others at risk. And I would say to those folks, you will pay your fine. And if you do not, you will not be driving your car. We will not issue you a driver's license. You can put your car up on blocks and you can leave it there until you pay your fine. And if you don't drive, we will garnish your wages. You will pay. Most importantly, it's important for you to understand this clearly. This is a danger. Your behavior is a danger to you, but it's more importantly, I guess, a danger to other people. So this Sunday is Mother's Day, and my best wishes to all of our mothers in the province. To those of you who break public health orders, give your mother flowers, not COVID. Think about that. Second announcement, a year ago, our government, along with Premier John Horgan, British Columbia, Sandy Silver was very supportive as well, newly re-elected Premier of the Yukon. The three of us, a Conservative, a Liberal, and a New Democrat, led the effort to lobby our colleagues to get the federal government to do a national paid sick leave program. We felt it was best, given the mobility of Canadian workers and given the importance of consistency across the country, there be a national program established. We thought that was the right approach. We lobbied our premiers. After repeated efforts, premiers united around this issue. The Council of the Federation, as it's called, the organization of premiers from coast to coast to coast, advocated on behalf of all of us to have the federal government introduce a pan-Canadian sick leave program. And approximately 2 weeks ago, the federal government announced that program in its budget. It wasn't what we had hoped. There are some serious flaws in the national program. The idea, of course, is to discourage people from going to work sick, but the federal program will encourage Canadians to go to work when sick because of some of its flaws, in particular in the qualification standards. I'll address some of these in a minute. But I want to say that we are disappointed, that premiers are disappointed, that Premier Horgan is disappointed that we did not have a program that we thought we were going to get. That being said, we need now to fill some of the gaps in the federal program. The federal paid sick leave program is not meeting the needs of workers across the country. That is not to say it doesn't have advantages. Most certainly it does have some. However, there's confusion. Employees, for example, have to miss the qualification period is that they must miss at least 50% of their scheduled work week in order to qualify. How do you know? When you're ill, when you're staying home for a day with a sick child, how do you know that you're going to miss 50% of your work week? Then you don't know. And if you don't know, you might be inclined to go back to work instead of staying home with your child. This is just one example. There are many others where the program leaves confusion where it should leave certainty. The onus is on the employee to apply and then to reapply each week up to a maximum of 4 times. That red tape for individuals is not just a hassle, it's a time-consuming expense. And it is there also for small businesses to absorb some of the consequences of that confusion and that red tape. There's also no coverage reference for employees who only need to miss perhaps 1 shift to go and get a vaccination. This puts an incredible amount of stress on Canadians who are already stressed, who are living paycheck to paycheck and who can't afford to miss a payment, so they go to work sick. This is not what we wanted. This is not what we thought we were going to get. And so today I am pleased to announce the Manitoba Pandemic Sick Leave Program. Donc aujourd'hui, j'ai le plaisir d'annoncer notre programme de congé de maladie PAI au Manitoba, conçu pour combler l'écart entre le programme fédéral de congé de maladie et les normes d'emploi provinciales pour le congé de maladie PAI. The Manitoba Safe Workplace Program, the paid sick leave program, will provide all private sector, nonprofit, and charitable employers with up to $600 per eligible employee for up to 5 days for COVID-19 related sick leave. Eligible sick leave would be any sick leave related to COVID-19, including testing, vaccinations, side effects, self-isolation due to COVID-19 symptoms, care for a loved one in any of these circumstances. Employers who currently provide paid sick leave to their employers wouldn't be eligible. Federal, provincial, local governments. Eligible employees are those who reside in Manitoba, work and receive wages in Manitoba on a full or part-time basis, it should be noted, as well. The purpose of our program is not only to protect you and to protect workers and customers of small businesses across our province, but to take the worry out of being sick. There's enough worry without adding to it by being concerned that you'll miss a payment from your employer as a result. So the online portal for employers will be available in the coming week with payments retroactive to today. The program will be available until September 25th. That coincides with the federal program. And more details will be available on our COVID-19 supports for business webpage. That's manitoba.ca/COVID-19/programs. manitoba.ca/COVID-19/programs. The Manitoba Pandemic Sick Leave Program is designed to ensure that hard-working employees do not lose their wages and employers are reimbursed in a timely manner. And I'd be remiss in not saying thank you to our small business employers for doing the right thing. I have had very good reports about the decisions that have been made by our small businesses to continue supporting their workers when they've needed to take time off. And I thank our small businesses for that. But this out-of-pocket expense doesn't result in any short-term benefits to their companies, obviously, as workers are not able to assist in running the businesses and operating them. What this program will do is provide that compensation to our small businesses. In addition, part 3 of this little lecture today is about health orders. Our health orders that were introduced just last week were adding to the restrictions we already had. And it is very, very difficult in this short term over the past week to ascertain what the impact of those restrictions will be. Obviously, we all hope it will be positive, but generally it takes a couple of weeks before you can measure the impact of additional restrictions, such as the ones we imposed on limiting gatherings, home gatherings, reducing the amount of percentage of business operations, and so on. That being said, out of an abundance of caution, later today, Dr. Roussin will be announcing additional restrictions that will come into effect immediately that will be there to take that extra step to make sure that although we are expecting and hoping that the number of vaccines available to Manitobans will be rising remarkably over the next number of weeks, we are not there yet. And this false sense of security with the positive announcements about more vaccines can be very dangerous if we believe that to be true. And so these measures are necessary. Again, I hope they are only necessary for a few weeks' time, but they are necessary in order for us to make sure that we do not allow ourselves to impose an additional burden on our healthcare system that is not one we can sustain. Before I take your questions, I just wanted to say again, congratulations and thanks to all our mothers out there, and a special thank you, if I may, also to our nursing staff and our frontline healthcare workers as they are dealing with this upswing in numbers of COVID cases. They are dealing with additional stresses that are adding to the challenges of their already challenging work life. And so I think on behalf of all Manitobans who would agree, we want to offer a voice of support and encouragement to all the folks who work in our front lines in healthcare. Happy to take your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from the Canadian Press, Steve.
Oh, hi, Premier. You mentioned a doubling of fines and a doubling of the default judgment for not paying your fine on time. I know that default is currently $50, so I assume that's going to be $100. And are all the other fines doubling? The $298 for not wearing a mask, the $1,200 and change for breaking public health orders, and the $5,000 on the corporate side?
My understanding, my assistant who's with me is frowning, and I'm not sure why. My understanding is that is correct, that we're doubling all fines, yeah. We'll verify for you, Steve. That's my understanding. Unless I'm getting a message to the contrary right now.
Individual repeat offenders.
Just for repeat offenders, Steve, to be clear, right? Doubling the fine for anybody who repeats the behavior.
Okay, thank you. And we've seen this third wave coming. Doctors have been warning that we are getting precipitously close to maxing out our ICU capacity. And I know you've said that stricter public health orders are coming later today. But why has the government allowed these numbers to grow so much before introducing further restrictions compared to a province like Nova Scotia that really clamped down with tough restrictions at a much lower rate of both hospital use and test positivity?
Well, we actually did maintain some of the toughest restrictions in the country. Our gathering size limits were lower than Saskatchewan, Ontario throughout most of the pandemic. Church gathering numbers were lower. I'm not suggesting that we haven't upped our restrictions. We have, but they began as greater and stronger than most other jurisdictions across the country, Steve. So 2 weeks ago, we introduced further restrictions. Last week, further restrictions, and more today.
From CTV Winnipeg, Jeff.
Hi, Mr. Premier. Do you have an update for us on the plan to vaccinate teachers in North Dakota? Where is that at?
Yeah, as you know, just for background, we proposed working with North Dakota some weeks ago, months ago, we worked with North Dakota to try to determine if they would have additional vaccines, pursued that avenue, found that Governor Doug Burgum and his team were very cooperative and supportive. We know we're in an intertwined economy, so we wanted to make sure that we fought COVID effectively together, as we have worked together in the Great Plains on other issues as well. So we were able to introduce a program to vaccinate truckers. I don't have the up-to-date numbers, but I know we're into getting close to 1,000, I believe, on first vaccine, and of course there's a second vaccine for them. It was my hope that we could have teachers vaccinated in North Dakota as well. My friends at the Manitoba Teachers Union thought that was disrespectful. It wasn't meant that way. It was meant to try to show, frankly, our government's respect for the work of our teachers and to help facilitate those who could travel 45 minutes to get a vaccine. Nonetheless, we have continued our dialogue all last week and this week with regard to getting White House approval to allow vaccines to be shipped up here from North Dakota. That's where we're at now. I would have preferred that we make the vaccines available quickly for those who are able to travel to North Dakota. Apparently, that wasn't well received. Nonetheless, we're going to continue to make every effort to get additional vaccines available in North Dakota here, into ARMS in Manitoba. And if we can get them shipped up, that's as much as it'll be. It's already proving to be a delay. But as soon as we can get approval from the White House, I'm hopeful that we can proceed in that way.
I know you say that MTS that it was disrespectful and didn't seem to want to have teachers go over the border, but I'm just wondering, is North Dakota saying, no, we can't have that, it has to be the vaccines going north? I'm trying to understand where North Dakota fits in all this. Have they said yes, let's have teachers come across the border?
North Dakota's been I want to eliminate any concerns about North Dakota getting cold feet. That's not true. Governor Burgum's been nothing but a saint through this process. He's been totally supportive of any effort we can make. We're hoping that we could get double vaccination sites, perhaps one at the Peace Garden in Western Manitoba, one obviously on the main route at Emerson. No, there's no truth to that. The difficulty is, of course, it's unprecedented to have an American state shipping vaccines across the line into another country, and we need approval from the White House before they can do that. They have to deal with the FEMA, the Federal Emergency Management Agency now. This introduces bureaucratic delays. That's not anything that any municipal official or individual who's dealt with a flood claim has an experience in. That being said, I would have preferred if we could have had people going right now. But that's not going to be the case. So we're waiting for an answer from the White House. North Dakota's put in that request, obviously, on our behalf, and we're continuing to work with North Dakota on this issue. I would emphasize again that our vaccine team has administered over 500,000 doses already. We're only talking about potentially several thousand here. It's a small side issue, but it is an important one. If we can get additional vaccines into ARMS, that's great for us in Manitoba, and I certainly hope that can be the case.
From the Winnipeg Free Press, Carol.
Good morning, Premier. Just wanted to know, when did you find out that Providence Therapeutics plans to pull out of Canada, and how does that affect Manitoba's deal with the vaccine developer?
Well, we have no deal with them until a contract's signed. There's no contract. We've got other irons in the fire, Carol, and as soon as we can finalize those, I'll be letting you know. But we definitely believe that domestic vaccine availability is an advantage going forward. We've never felt that this was a panacea to our problems during the initial part of this pandemic, but as far as for booster shots in the coming years, it would be better if we didn't have to go cap in hand to other foreign providers. And I think most Canadians understand that when they see other countries taking care of their people first, with the possible exception of North Dakota and the respect they've shown to Manitobans, and I will go back to that, we have a real benefit if we can boost our domestic vaccine production. So that's what Manitoba has been taking the lead on, encouraging. And as I said, I'm hopeful we'll have more to share with you as early as next week.
And why do you think it's okay that your health minister isn't being made available to reporters during the health crisis to answer questions? If she has time to do a tour of a super site, surely she has the time to discuss pressing issues with media.
Well, I think our ministers have been incredibly available and reliable in being available throughout this pandemic, so I have nothing but respect for our health minister and her colleagues, and I'll continue to demonstrate that in my comments.
From Global News, Merrick.
Hey, Mr. Premier, just circling back to teachers in Manitoba, expressing some disappointment with the plan involving North Dakota. That aside, though, what's your message to our teachers who've been watching educators in some other provinces book appointments for the vaccine as they remain ineligible here in Manitoba?
Well, teachers, of course, are not ineligible. They are eligible in many respects in most areas of the province, and the hot zones at any age and others at reducing ages. And so teachers are most certainly getting vaccinated. And I wanted to say thanks to the teachers that have communicated with me over the last few days for their encouraging and supportive comments, not at all consistent with the position of the Manitoba Teachers Society. That being said, I have great respect for the Manitoba Teachers Society. I couldn't have advanced my education without a scholarship from the Manitoba Teachers Society, so I'll leave it there. But no, teachers aren't of one mind here. Many teachers are really pleased that we were trying, and they took our efforts to be good-hearted and sincere. And so we'll continue to make every effort to assist not only teachers but all Manitobans in getting vaccinated as soon as possible.
And do you think waiting until we're in the midst of a third wave, do you think waiting until this point could have to implement a provincial sick leave program could have contributed to the case numbers that we're seeing now?
I think, sadly, trusting the federal government to come out with a program that didn't try to cheap us by being confusing for the first week was a mistake. Yeah. That being said, we were given assurances week after week on our calls with senior officials in Ottawa that they were developing a program. We assumed it would be one that would be comprehensive and simple and straightforward to get into. It isn't. It's fine after the first week. As I said, it's there are criticisms of it. Some will say it should be for everything. I expect the union movements will advocate for that. They have for some years. Some will say it should be for much more money. It's a basic amount that is consistent, I think, with the CERB program. But the problem is in the early days, it's confusing. And so our program is designed to address that confusion, make it simple and straightforward. I'll say to every small business person in the province of Manitoba, thank you if you've been paying your staff when they're sick. Now we'll pay you for paying them up to certain maximums for that first week. So please make sure you encourage your folks if they're ill to stay home. Make sure that if they have to get tested, pay them and let them get tested. If they have to go for vaccination, pay them. And send the bill to me.
From the Brandon Sun, Drew.
Thank you. Mr. Premier, just for clarity's sake, but has the plan to have teachers vaccinated in North Dakota, has that officially been shelved in favor of having the vaccine doses shipped up north in those discussions with the White House?
Yeah, so North Dakota's put in that request I think at the tail end of last week, Drew. I'm not sure the exact hour, but I know the request's been there. And our hope would be, obviously, if we can get a truck down there, get the vaccines up here, that's better. But I knew at the start that plan would take a while to get approval. So North Dakota is trying very, very hard. They've been in dialogue as recently as late yesterday, again with President Biden's office, to get approval, to get some vaccines up here. And I'll tell you what, if I can get Governor Burgum to come to that border and shake his hand, I'll do it, because I appreciate very much the efforts he's made. And I know that Manitobans appreciate them too.
Well, he's in court right now.
Okay, thank you very much. Right now we're seeing the daily COVID numbers rise quite a bit. We're seeing more people in the ICU. You said yourself that we're firmly in the third wave. Do you feel that the government has done enough to prepare at this point?
Well, we're learning every step of the way. It's an unprecedented pandemic. So we've incorporated some of the strongest restrictions in the country. We have the strongest enforcement mechanism in the country. We have communicated our fine and enforcement regime to Manitobans on a weekly basis. Nobody else does this. We have thousands of people involved in the enforcement, the ticketing, boots on the ground. We're targeting to the hot zones. We're making sure that we're out there. If somebody's got suggestions, I'm always ready to listen, and I have acted on many of them. But as far as preparatory work, we were the ones who were advocating for sick leave months ago. We took the lead on that. We've taken the lead on the enforcement side. We've maintained, according to Oxford University, and this was as of 8 weeks ago, maintained the toughest restrictions in the country outside of the Atlantic bubble. We're doing everything we can. I would say to Manitobans, very likely it's because of your decisions to act on our health orders and the rules we brought in with foresight that we were able to delay the onset of this third wave. And you deserve credit for that. So knowing that, these additional measures today should be able to assist us, I hope, in shortening the length of time that we have to deal with this third wave. That's a positive thing. Nobody has been able in this country and in most places in the world to keep the third wave out. And so I say to the Monday morning quarterback people, you know, sure, we should have, could have, might have. That's fine. Nobody else did that. Nobody else has been able to do it. We've delayed the onset of this third wave effectively as people, and I think Manitobans need to know how much I respect and thank them for doing that. We bent that wave. Now we've got to do it again. We did it before, so let's do it again. Play defense for the next few weeks, and let's get past this and move to a brighter future together.
From CJOB, Clay.
Good morning, Mr. Premier. The numbers yesterday, well over 300. I know you had mentioned that Dr. Roussin was going to announce some new restrictions that probably will take effect before the day is over. But if we continue to see numbers in the very high 200, 300 range for the next week or so, 300 plus, a little less than 300, would you consider a lockdown?
Let's hope not, Clay. We've taken the advice of our health experts throughout this pandemic. We'll continue to. Dr. Roussin is unfortunately tied up in a court case today for part of the day, or he might be available sooner. I understand there's going to be press briefing. I think Lynette Saragusa, if I'm not mistaken, Dr. Atwal are both available in the next few minutes or hours. Dr. Roussin will be out later today. I would just say we've acted out of an abundance of caution throughout. We'll continue to do that. There'll always be those who say we should have done more. There'll be those who say we should have done less. We've done our best. We've added, since I came to this position as Premier, we've added over 1,700 nurses in this province. We've added 40 staff just in the last few days to our ICU units. Pre-COVID, our capacity in ICUs was about 70. We're now at about 130 capacity. God willing, we don't need it, but it's there. And I would say, and I hope not out of an excessive abundance of optimism, I have faith in Manitobans that we can do this together, and that this is a few weeks of hardship that we have to endure together to get through to the light at the end, which is a partial recovery of our lives as we remember them prior to this COVID pandemic.
Quick follow-up. We still get comments from listeners about the large gathering a couple of weekends ago at the Forks, a few hundred people there. Last time I looked, there had been some tickets issued, but not that many. Is the province still trying to track these people down? I mean, we're talking maybe 200-300 people.
Yeah, last I've heard, Clay, I haven't got an update today, but I think we were over 20 tickets already, significant fines. And there's more investigative work that was done, videos taken, things like that. Tips also coming in, and Justice Department is acting on those. It's tricky. I mean, we're all frustrated. I heard it in the mayor's comments yesterday, and deservedly so. We're all frustrated with this scofflaw behavior, and it's so disrespectful. It's hard to describe it as anything but that. That being said, again, we're doing everything we can on the enforcement side, on the collection side, and the stepping up today with additional deterrents to get these folks to behave respectfully to the rest of us.
From the Winnipeg Sun, Josh.
Good morning, Premier. Josh Aldridge, Winnipeg Sun.
You've talked about all the precautions that we've taken, still under some pretty strict lockdowns or health orders. How did we get to this point where we've had this time to watching what's happened in other provinces to make these adjustments? How do we get to this point where all of a sudden we are seeing this big spike in cases? What's your read on how we ended up at this point?
Well, I think part of it, of course, is the behaviors that people who do not follow the health orders have demonstrated they're willing to engage in. A lot of it is not masking. A lot of it is not social distancing and gathering and congregating in dangerous settings. A lot of it is that kind of behavior. Not all of it, but a lot of it. And it's difficult because we have maintained some of the toughest restrictions, and it doesn't matter if, for those who don't obey those restrictions, it doesn't seem to matter. We've invested so much time and effort in right back to Ready, Safe, Grow program last summer, where 2/3 of our investment was in the safety side, educating people, encouraging them to do the right things. We've continued to do that. As I said at in a year-end interview, I think with you, Josh, my regret, or with Brittany Greenslate from Global, was that my regret was that we didn't step up earlier with more deterrence and fines. We have now, and we've really strengthened that system to be the strongest, I'm told, in Canada now. So we're going to continue to do those measures. It's such an insult to the people who've been doing the right things, our family members, respecting each other and their neighbors, our small business people, caring for one another and acting accordingly, to see people continue to disobey these rules. But the reality is these penalties are real, and I want the message to be loud and clear to people. Again, put your car up on blocks, because you're not going to be driving it unless you pay these fines. But better than that, just don't do it again, because if you do it again, it's going to be twice as costly to you.
My follow-up is more to deal with the sick leave program. Many other provinces, including, I believe, BC, went to provincial sick leave within days of the budget. Why didn't Manitoba? What took so long? And now that we are going to this type of a program, is this a sign that you've given up on the federal government to fix their program, or are those negotiations going to continue?
I'll just offer a quick correction there. Alberta and Saskatchewan have not introduced paid sick leave. They've introduced a vax leave, 3-hour max program. BC hasn't introduced a program, though I've been in touch with Premier Horgan's office, and they will be introducing something in the coming days. Our program, Ontario introduced a proposal to double up on Ottawa's benefit, which was rejected by Ottawa. Their program has come up. I think it's a 3-day max program. This will be the most generous sick leave program in the country. It's designed to work. It's designed to offer real certainty to workers and employers that they will be paid if they do the right thing. And yes, we could have done it sooner, but we were working on good faith that Ottawa was going to develop a program, which they had assured us repeatedly they would. They did develop a program. It's just got these gaps in it, so we're addressing the gaps in the program.
From CBC Radio Canada, Mohammed.
Hello there, Mohammed from CBC Radio Canada. All my questions were answered today, so I'm good. Thank you.
Mohammed.
From CBC Manitoba, Bart.
Hello, Mr. Premier. You have repeatedly stated in this press conference and others that we, had tougher restrictions before when brought them in, but I do have to point out that when you saw the beginning of the exponential curve, it clearly indicated on April 14th that the numbers would go the way they have. You don't even need to be an epidemiologist. You can just have your basic high school arithmetic to see that. Logically as well, the ICU numbers are following. I have to ask you again, why, given the positive experience in jurisdictions around the world, including some in the Maritimes, including some of the islands, why Manitoba just didn't put that circuit breaker in 1 month ago to make sure that we aren't at the point we're at now?
Yeah, I think that's a fair question. You could ask that question of 7 other Canadian provinces that are experiencing the third wave and had their peak over the last 3 or 4 weeks as well. we introduced tough restrictions on already tough restrictions 2 weeks ago and strengthened them last week again. So your question is essentially, why didn't we do that a week before that? Because we introduced those tough restrictions and we still don't know how effective they'll be. That question can still be asked. My hope would be that those restrictions we introduced last week, which limit outside gatherings significantly in households, would be a key contributor, if people follow those restrictions, of course, to us bending the curve. Measures that Dr. Roussin will announce today will add to those. But again, no restrictions work unless people work at them, as you well know. And so that is, at least in part, I think, the defense for the method we've used throughout this pandemic to communicate openly with Manitobans the rationale for doing the things we've done.
We now go to City News and Mike.
Do I not get a follow-up? Do I not get my follow-up?
Yes, you do. Correction. We continue with Bart.
Thank you very much, Paul, and pardon me for being insistent. Mr. Premier, we're likely, as Clay mentioned, we've seen average case counts climb up. We're probably going to hear something in the 500 range today. What do you say to Manitoba? They may have trouble grasping things like exponential growth curves, ICU projections. Case numbers are really easy for the average Manitoban to grasp. What's your message for Manitobans when they see, if they see, a 500 number today?
It'll be the same as it's been throughout this pandemic, Bartley. Follow the health orders. Adhere to them. The future is in the hands of Manitobans, as has been the past. We've maintained tougher restrictions on group sizes. BC has never restricted small business, for example. We have. We've maintained smaller gatherings for churches, for assemblies of various kinds, inside. We've maintained more restrictive rules for travel than anyone outside of the Atlantic bubble, as you well know. Again, as a government, we continue to utilize the best strategies we can for enforcement, for messaging, and as well in terms of our public health orders to protect our healthcare system as best we can. But the future is in the hands of Manitobans. Most Manitobans have been following the health orders. If we would all do that, we could bend this wave back because we did it before, and I think we can do it again. And so again, my message is for those who choose not to remind them that they are not only putting their own health at risk, but they're putting the health of their family at risk. Give your mother flowers on Mother's Day. Don't give her COVID.
And we now go to City News and Mike.
Good morning, Mr. Premier. Businesses have frequently said that they'd like more notice when there's going to be changes. I understand why this change is coming so rapid at 12:30, but is there any restrictions that you can hint at or kind of tell businesses so they just have even that extra hour to start preparing for this change?
I won't speak for Dr. Roussin. I'll let him speak as we have throughout this pandemic on the public health orders. I will only say again to our small business people, thank you for doing your best to fight this pandemic. The measures that will be taken won't be undertaken happily that might affect small businesses, but they are necessary, and I'll support Dr. Roussin as I have throughout this pandemic in this. However, I will also add that our sick leave program is a significant additional thing that our business organizations have been asking for privately in discussion with my ministers and with me. And I think that our small business community will very much appreciate our announcement today about those programs going into effect immediately to assist them and to encourage also their employees to do the right thing and stay home when sick without the fear that they will lose a paycheck.
And then for my follow-up, just how immediate is immediate? Are these health orders going to kick off at 12:30, or is this something that it's going to be Saturday?
Yeah, I'll let Dr. Roussin do the announcements. Again, we think the urgency is real. And so not at 12:30, no, because he is unfortunately occupied in defending our province's rule structure in a court case across the street from the legislature right now. But it is Dr. Roussin who will be making those announcements at some point later today. And again, those restrictions will be necessary and important out of an abundant sense of caution to do everything we can together. And again, I know there are sacrifices here, and Manitobans are, I think, deserving of tremendous credit for putting up with these things. But we know we have to secure our healthcare system and to protect one another for at least a few more weeks and do the right thing. Dr. Roussin will have more to say on that later today.
And our final reporter this morning from CBC National News, Cameron.
Hi, Premier. Just, kind of going back on enforcement here, and I can hear the frustration in your voice, and everyone's getting pretty frustrated. We're seeing, there's video floating around of people being handed tickets that are refused, they're just walking away. Beyond trying to take their driver's licenses, if you can figure out who they are, how do you deal with that? Do you need a new tactic here?
Well, the video follow-up is apparently pretty effective, so we know who's driving what vehicle and which one they get into, so that's a pretty good clue right there, Cameron. And again, I'll say to those that want to flaunt these rules, they're making a big, big mistake. It's going to cost them in their pocketbook, and if they don't think they're going to pay, they're wrong. Because again, I hope they got a garage because their vehicle is going to be in it for a while. So behave responsibly, don't get a fine, don't do things that are endangering yourself and others, and you won't have to worry about this. But you're going to have to worry about it if you're going to disrespect your fellow citizens with selfish behavior.
And following up on what's happening across the street, as you mentioned, anything can happen in court. Your chief public health officer can't make an announcement right now because he's in court defending Manitoba's health orders. How confident are you in Manitoba's case?
Totally. We've got the best justice advice we can get in our government. I thank our officials for their prudence and direction. Again, I'm a freedom-loving guy. I do not love this part of my job, telling people that they can't do things, get together with family and friends. It's Mother's Day. For heaven's sakes, who enjoys this? But the fact of the matter is we're doing tough things that have to be done to protect people. And so what's more important than that? I don't think too much. Thanks, everybody.